typical first symptoms of carpal tunnel syndrome will be tingling or pins and needles extending down into the hand. This is often first an issue at night, so it may wake the person up with numbness and tingling, or could occur when they're driving along, the hand will go numb and they have to take their hand off the wheel to shake it to get the life back into it, or can occur when someone's just sitting still, for example, sitting reading the paper. And typically the little finger is least affected. When a patient comes to see me, I ask them the history, and they often will recount symptoms of tingling and pins and needles in their hand. To examine them, the first thing is I look at the hand. If it's a severe case, then they may have wasting of the muscles in the pad of the palm at the base of the thumb. I look for any evidence of an old injury to the wrist, that it might look misshapen, which could increase the likelihood of carpal tunnel. I then assess the feeling of their skin. This will start with just brushing the skin to see if they feel that that's normal compared with what they'd expect. And then more specifically, to measure whether there's a loss of sensation, we can do a test called a two-point discrimination. When I'm examining somebody with carpal tunnel, the special tests that we do as part of the examination, the first one is called Tinel's test, where the examining surgeon will tap on the front of the wrist. And if somebody has carpal tunnel, then they may well experience a tingling sensation going down in the fingers or going up the arm, or even if it's unpleasant, an electric shock type sensation. Two other provocative tests we do called Tinel's test, where the wrist is bent forwards and held in this position for up to a minute, and this may bring on the sensation of numbness and pins and needles in the fingers, or reversed Phelan's test, where the wrist is bent backwards. The test that I find probably most sensitive would be a combination of Phelan's test and something called Durkin's test, where I bend the wrist forward and then apply pressure to the front of the carpal tunnel. And if that brings on the symptoms in the fingers, then that to me is quite suggestive of carpal tunnel syndrome. For some patients, if from the history in examining them there's doubt as to whether the diagnosis is carpal tunnel syndrome or not, then they can be referred for what's called a nerve conduction test, which is an electrical test where a neurophysiologist records the conduction of electricity across the carpal tunnel and then can work out whether there is slowing of the conduction consistent with the diagnosis of carpal tunnel syndrome. If somebody is concerned that they might have carpal tunnel syndrome, the most important thing is to make a mental note of when they get the symptoms and also what they can do to relieve it. So if for example, they've been woken up in the night with numbness and tingling in the hand, then often shaking it around or hanging it over the side of the bed, and that relieving the symptoms would be suggestive of carpal tunnel. One of the treatments that is always worth trying is to wear a splint on the front of the wrist that stops the wrist moving. And if someone is concerned they might have carpal tunnel syndrome, then obtaining one of these splints and wearing it at night, if that then gives them a better night's sleep, then that might suggest that the diagnosis is carpal tunnel syndrome. The condition can resolve spontaneously, so I think when someone first presents with symptoms, it's not unreasonable to give it a bit of time to see if it settles down. If the splint controls the symptoms, then this is a perfectly good way to manage the symptoms. And if, for example, a lady who's pregnant has developed carpal tunnel syndrome during her pregnancy, then managing the symptoms with a splint is often all that's required, so that once she's had her baby, in the majority of cases, the symptoms will then settle. Another treatment that can be offered is a cortisone injection into the carpal tunnel, and this will often relieve the symptoms, but in many cases this will just be temporary relief. But how long they get the benefit for is quite unpredictable and variable. If somebody has persisting symptoms, they've tried these more conservative measures and they're still very troubled by them, then at that point surgery may well become appropriate. The other group of patients where we would recommend surgery is if the severity is such that they've actually got permanent numbness of the fingertips, or if the muscle in the hand is getting weak or wasting away. And if in that situation, then a surgical release of the nerve is the only treatment which is likely to reverse the changes.